TYMLOS is a prescription medicine approved to treat postmenopausal women and increase bone density in men with osteoporosis who are at high risk for bone fracture or who cannot use another osteoporosis treatment or other osteoporosis treatments did not work well. Do not take TYMLOS if you had an allergic reaction to Abaloparatide or any of the other ingredients in TYMLOS. The inactive ingredients in TYMLOS are phenol, sodium acetate trihydrate, acetic acid, and water for injection. Please see additional important safety information throughout and at the end of this video.
Oh, Pensacola is a great place to live. They get good weather. You can play golf almost year-round. My name is Conrado. I'm a retired Air Force and Postal Service. My family is very important. My daughter Patty takes good care of me.
My dad is always moving and active. He's in the generation to where if you stay still, you're not being helpful.
Well, I can fix just about anything. I've been playing golf for at least 25 years, and I play 4 times a week. I have 8 holes in one, and I'm really proud of it.
My mom was his everything. She was our everything. She made sure that everybody had everything that they need, so when she's gone.
Especially when it happens so suddenly, it's really hard.
He's very independent. He likes to do things on his own and doesn't like to ask for help, so we were always worried about him being alone.
Well, at church, I like to sing, and I'm part of the choir. But during the break, I bent down to pick up something, and when I got up quickly, I feel dizzy and fell down on the stage.
They found out he had broken ribs.
My doctor diagnosed me with osteoporosis. My reaction is that I know it's something serious. I'm afraid that I won't be able to do what I used to do.
With osteoporosis, we know more that women are the one who usually get it. So when my dad got diagnosed with osteoporosis, it was a big surprise to us. With my dad living alone, it did give me a lot of concerns that he may fall and break something. The first step was contacting the endocrinology office and getting him an appointment. They specialize in osteoporosis and getting them treatment. The doctor said that it's very important for him to start some type of regimen. With the information the doctor had given us, then all the research that we did, we felt that TYMLOS gave us confidence to be able to have my dad, one, do it on his own, and that it would help build his bone density.
Using the pen, actually, it's not a hard thing. My routine is that I do that the same time every day, between 6:30 and 7 o'clock. I take the TYMLOS out of the box, put the needle on, and inject it myself. Once you use it, you just go around your stomach back and forth.
I would tell people, especially for the men, if you have osteoporosis, do some research and talk to your doctor and find out what your risks are and which treatment would be best for you.
TYMLOS look attractive to me based on the data about bone density.
We knew that my dad was high risk at getting another fracture, so we had to do something.
I know I have a chance to have the life that I wanted to have.
Important safety information and indications. What is the most important information I should know about TYMLOS? TYMLOS may cause serious side effects, including possible bone cancer, osteosarcoma. During animal drug testing, TYMLOS caused some rats to develop a bone cancer called osteosarcoma. It is not known if people who take TYMLOS will have a higher chance of getting osteosarcoma. Tell your healthcare provider right away if you have pain in your bones, pain in any areas of your body that does not go away, or any new or unusual lumps or swelling under your skin that is tender to touch. Do not take TYMLOS if you had an allergic reaction to Abaloparatide or any of the other ingredients in TYMLOS. The inactive ingredients in TYMLOS are phenol, sodium acetate trihydrate, acetic acid, and water for injection. Before you take TYMLOS, tell your healthcare provider about all of your medical conditions, including if you have Paget's disease of the bone or other bone disease, have or have had any of the following: cancer in your bones, radiation therapy involving your bones, too much calcium in your blood, or an increase in your parathyroid hormone, hyperparathyroidism. Will have trouble injecting yourself with a TYMLOS pen and do not have someone who can help you. Are pregnant or plan to become pregnant, because TYMLOS is not for pregnant women. Or if you are breastfeeding or plan to breastfeed, it is not known if TYMLOS passes into your breast milk. You should not take TYMLOS and breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of TYMLOS? TYMLOS can cause serious side effects, including decrease in blood pressure when you change positions. Some people may feel dizzy, have a faster heartbeat, or feel lightheaded soon after the TYMLOS injection is given. These symptoms generally go away within a few hours. Take your injection of TYMLOS in a place where you can sit or lie down right away if you get these symptoms. If your symptoms get worse or do not go away, stop taking TYMLOS and call your healthcare provider. Increased blood calcium, hypercalcemia. TYMLOS can cause some people to have a higher blood calcium level than normal. Your healthcare provider may check your blood calcium before you start and during your treatment with TYMLOS. Tell your healthcare provider if you have nausea, vomiting, constipation, low energy, or muscle weakness. These may be signs there is too much calcium in your blood. Increase urine calcium, hypercalciuria. TYMLOS can cause some people to have higher levels of calcium in their urine than normal. Increased calcium may also cause you to develop kidney stones, urolithiasis, in your kidneys, bladder, or urinary tract. Tell your healthcare provider right away if you get any symptoms of kidney stones, which may include pain in your lower back or lower stomach area, pain when you urinate, or blood in your urine. The most common side effects of TYMLOS in women with postmenopausal osteoporosis include dizziness, nausea, headache, fast heartbeat, feeling tired, fatigue, upper stomach pain, and spinning feeling, vertigo. The most common side effects of TYMLOS in men with osteoporosis include redness at injection site, dizziness, joint pain, swelling at injection site, pain at injection site, bruising, abdominal bloating, diarrhea, nausea, abdominal pain, and bone pain. These are not all the possible side effects of TYMLOS. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. How should I use TYMLOS? Read the complete instructions for use provided with your medicine. If you take more TYMLOS than prescribed, you may experience symptoms such as muscle weakness, low energy, headache, nausea, dizziness, especially when getting up after sitting for a while, and a faster heartbeat. Stop taking TYMLOS and call your healthcare provider right away. You should not use TYMLOS for more than 2 years over your lifetime. What is TYMLOS? TYMLOS is a prescription medicine used to treat osteoporosis in postmenopausal women who are at high risk for bone fracture or who cannot use another osteoporosis treatment or other osteoporosis treatments did not work well. TYMLOS can decrease the chance of having a fracture of the spine and other bones in postmenopausal women with thinning and weakening bones, osteoporosis, and increase bone density in men with osteoporosis who are at high risk for bone fracture or who cannot use another osteoporosis treatment or other osteoporosis treatments did not work well. It is not known if TYMLOS is safe and effective for children and young adults 18 years and younger. TYMLOS should not be used in children and young adults whose bones are still growing. Please read the full prescribing information, including medication guide, at TYMLOSPI.com.